Welcome to the Accomplished Brain Podcast, where we share our passion, knowledge, and experience about the brain and health.
Welcome to the Accomplished Brain Podcast, where we talk brain health, chronic neurological disorders, and current health topics. So today's topic is going to be about sleep. So when we all think sleep, we think of your body recovering, our nervous system recovering. And what we want to kind of talk about today is what's happening at the chemical level, what helps us get to sleep, what helps us wake up, what's happening during REM sleep, so on and so forth. And I think kind of the general look at this is, sleep is a fantastic time for our immune system to replenish, for our hormones to balance themselves out, for our musculoskeletal system to relax and replenish. One of those hormones that replenish themselves is also the growth hormone. So if you're growing or you're building muscle mass, so on and so forth, that's very important. So when we talk about this today, we're definitely going to kind of go through what's happening at the chemical level, what our brain is going through as we sleep. It's kind of a common misconception that our brain is also firing down when actually it's actually firing at a very rapid rate. It's just working very differently than it is when we're awake. So we're going to break all that stuff down and we're going to talk about those kind of correlations with, is there a correlation with lack of sleep and Alzheimer's, depression, anxiety, pain, that sort of thing? So Andrew's going to kick us off today and lead us into, can we fall asleep and why do we fall asleep?
Yes. Thank you, Jeff. Appreciate that. And that was a great introduction. Really excited to talk to you guys today about sleep. And, for me, I'm diving more and more into sleep with every client. And I think there's fundamentals that that I see in helping people, improve their function. I think there's like really key things that you're going to find with almost every type of neurological case, like concussion, traumatic brain injury, stroke, Parkinson's, movement disorders, balances. I think balance is a key. I think that sleep is a key. I think managing blood sugar is a key. Managing inflammation is a key. I think your coordination, your cerebellum is another key. So I think sleep is up there as one of those really key components. As Jeff said, is that we as a human being, we need to rejuvenate, and we need to we need to have our immune system kind of like recharge. We need to have our whole nervous system recharge itself, and sleep is a huge component of that. So I think the better that people have their sleep in order, and there's different parts to it, I think the overall that's one really huge component of overall health, and especially in the neurological and the brain world. So with that said, I want to go into some of the mechanisms of the can you fall asleep. So I want to look at it from the neurological and chemical side, neurological circuitry side, and then I want to look at it from like some of the important hormones and chemicals that are involved as well. Okay, so the first thing that happens is you have an area of your brainstem called the hypothalamus. So basically, you have your brain, and then below that is the sublayer. You have your brain, you have your brainstem, and below that brainstem is like a sublayer. You have your brain, sublayer, the brain, and then brainstem. Sorry about that. So brain, sublayer, brainstem. So in the sublayer of the brain, you have an area called your hypothalamus. That's a huge area where a lot of our hormones sit. Hypothalamus is important for sleep, and again, not everything, but these are the things I focus on with the hypothalamus. So your ability to sleep or fall asleep, your ability to wake up. A lot of your hormones are originated, the original pathways to stimulate your hormones in the pituitary come from the hypothalamus. Okay. So hormones, your appetite, light stimulation, and temperature. Now, that's not the only things, but the hypothalamus, those 6 key things are really, really, really important. So, and then some of those areas and I want to share with you is the hypothalamus is kind of also the beginning layers of your autonomic nervous system, right? So your autonomic nervous system has 2 parts, right? Has one part that is going to drive us, get us up, get us fired up, ready to go. And then it's that part that's called your sympathetic. And then your other part of your autonomic system is called your parasympathetic, that kind of calms you down and relaxes you, right? So your autonomics, the hypothalamus has a huge play. Preferably the anterior hypothalamus has a huge play on the parasympathetic system, right? So relax. And the posterior and lateral part of the hypothalamus have a big play on your sympathetic system. Okay. So basically, I'm talking about this hypothalamus, and I want to bring this back into the mechanism of sleep. So one of the first things that happens is in your ventral lateral preoptic area of your brain, your ventral VLPO. So your VLPO, ventral meaning front lateral preoptic area of the hypothalamus. You activate a neurotransmitter. Remember we said neurotransmitters are chemicals that also help us send messages. Some modulate, meaning they kind of with the word I want to say, they support, modulate the nervous system. Some neurotransmitters excite, and some inhibit and relax. So GABA is a neurotransmitter that relaxes the nervous system. So in the ventral lateral preoptic area of the hypothalamus, you make GABA, and then that GABA comes in and basically inhibits orexin, okay, and it inhibits histamine. So histamine and orexin. So those are 2 hormones that have to be inhibited for the nervous system to start to calm itself down. Okay, so orexin is basically, orexin sits in the posterior hypothalamus. So again, remember we said the posterior hypothalamus is an area that for the the posterior hypothalamus influences the autonomic nervous system that gets us excited and arouses us. So orexin has to be inhibited by the GABA. So GABA from the VLPO, the ventrolateral preoptic area, comes in and plays nice with the orexin and calms the orexin down. Okay. The other thing that the VLPO, when GABA gets excited, is it inhibits histamine, right? And histamine is in the posterior part of the hypothalamus in this area called the tuberary mammary area, right? And what happens is that's also where acetylcholine is made. So I'm going to talk about the acetylcholine and REM sleep. So we're going to kind of talk about that. Now, here's the thing, is that histamine is a lot of times produced with allergies. So think about this. If you eat a food that you have some kind of allergic reaction to, and then you try to fall asleep, and your histamine levels are going to be high, right? And there could be a challenge with you dulling your system or your nervous system down to fall asleep. So again, histamine levels need to be histamine needs to be inhibited. Orexin needs to be inhibited. They're both in the posterior and the lateral part of the hypothalamus. The posterior hypothalamus and lateral part of the hypothalamus excite the nervous system. The autonomic nervous system, right? The part that gets excited is sympathetic. They have a role. So the GABA comes in and inhibits that and calms that system down. Okay. So once that happens, okay, now we're going to talk about, so that's one aspect. So GABA has to be, you have to activate GABA in the ventrolateral preoptic area of the hypothalamus. GABA comes in and inhibits in the posterior and lateral hypothalamus. GABA comes in and will inhibit a hormone called orexin. And orexin is to arouse us. So orexin needs to be low when you're ready to to allow you to fall asleep. And histamine. We know histamine can be activated with some kind of allergic or allergy reaction. So histamine levels need to be low. And then GABA inhibits the histamine and the orexin. The other things that have to happen is another chemical reaction is, and again, a lot of your chemicals, a lot of your hormones sit in the hypothalamus, right? So hypothalamus is a really important area for the sleep cycle. So what then happens in addition to that is we need cortisol levels to be low, okay, which allow melatonin levels to be high, right? Or actually, which allow, so cortisol
Serotonin.
here's the thing. Cortisol has to be low, serotonin has to be high,
Right.
and serotonin is a precursor to make melatonin, and melatonin dulls the pineal gland, right? And allows, again, as the pineal gland dulls, again, further allows you to fall asleep. So if you're thinking about sleep, the mechanism, you need to look at GABA being high, right? Serotonin levels to be high in the beginning, melatonin levels to be high, right? And then cortisol to be low, orexin to be low, and histamine to be low. Okay. Now, so that's kind of the mechanism of now to allow you to fall asleep. So the thing is that, so what if some of the things that you could do? Well, one is if you're having sleep problems, a good thing to do possibility is to take a saliva cortisol test. And usually when you do a saliva test, they're going to look at your cortisol rhythm. Cortisol usually is high, it should be high in the morning. It's the rhythm, right? And low, it gets lower as the day goes on. It gets its lowest point at night. So here's the thing. A lot of times, and this is some old stuff, but I'm going to bring this up. I've always looked at memory, and the memory in the medial temporal lobe, there's an area called your hippocampus. And a lot of times the hippocampus has a huge role, not only on memory, but on modulating the cortisol rhythm. So again, another link, if you're having sleep problems, right? So then you look at and you say, okay, I have sleep problem. I have problem falling asleep. So then I look at and see, probably first thing maybe I want to look at maybe is my cortisol rhythm. Cortisol rhythm is off. Then I'm going to say, you know what? Am I having, some issues, or say someone I live with, whether it's my parents, whether it's, if you're a young kid, well, if you're an older and you have a significant other, whether it's your girlfriend or wife or whatever, and they say, or a husband or whoever it is, and you want to say, ask if, they think you're having any problems with memory, right? So there's cortisol, there's sleep, cortisol rhythm, then you're looking at memory, because the memory has a role on that cortisol rhythm, and the cortisol rhythm and the cortisol being low helps. So again, this is how everything is a functional. Functional means how everything is linked together. You can't just look at one thing. You have to look at everything, and then you have to look at how everything connects together. That's the important point. Okay. So then I want to look at, there used to be a way of looking at serotonin through urine tests, but one of the things we could do is understand like what makes serotonin. So usually tryptophan, and you could get that in food. Tryptophan makes 5-HTP. 5-HTP then turns into serotonin, and there's some cofactors that help. Cofactors mean there's chemicals that help make one equation to the other. So in the case of like magnesium, iron, B vitamin, these are all things that are important in the equation to make that serotonin. So then I'd say, do I have any B vitamin issues on the lab, right? That could be something. Do I have an iron problem, right? Do I have any anemia, right? That's another thing. Now, then at night, before I go to sleep or my last meal, I could get foods like, chicken, turkey. There's a whole list of foods that, we could, what we'll do is on our beginning of our next segment, we'll kind of put up a document of all the foods that tryptophan. But tryptophan, so you could, and that's what I'll have a lot of people do is they have problems falling asleep. We'll try to work through the mechanism in the equation, right? So the first things like I'll have is, get them to, eat certain foods that are going to have more tryptophan in them, right? Or get green leafy vegetables that have magnesium, B vitamin, get foods like spinach, in some of those green leafy vegetables that can help improve iron levels, right? So again, cortisol, right? Cortisol has to be low. You have to look at the cortisol rhythm. So you're looking at memory, hippocampus function. Then you're looking at serotonin, because serotonin is a precursor to make melatonin, right? So you gotta find out, make sure I'm making the melatonin. And then GABA, some things that we could do, foods, but there's other things that we could do with stimulation is in the vestibular system, when you're activating one ear canal, the other ear canal is being inhibited and you're using GABA. So I tend to, a lot of times at night, I'll tend, and I'll also, if you look at in neurology, there's certain nerves that will fire into the vagal parasympathetic system. And one of them is your accessory nerve, which is head and neck movement. So when I give people our software called Activator, our virtual reality software that we can move their head and neck and activate their vestibular system, we can help them on some levels that they're producing some GABA, and I'll have them do that a little bit before they go to sleep, and it'll fire into their parasympathetic system, right? Because again, the GABA has to, from the ventrolateral preoptic area in the hypothalamus, has to inhibit the orexin, which is an arousal hormone, and it has to inhibit histamine. The other thing I'm going to do is if I think that they're having some issues with, I might put them on like an antigen elimination and diet. So I might put them on diets that get them off gluten, get them off corn, get them off soy. I might have a whole list of foods because if they're reacting to certain foods, that can increase their histamine levels, right? So let's go back to this, right? One is you want to make sure that their cortisol rhythm. One, you could do saliva cortisol test. And if their rhythm is off, then you want to ask them some questions about the memory, right? So then you want to start stimulating their memory at the same time to restore their cortisol rhythm function, support their hippocampus. We have ideas that we can do we're going to probably do a whole or a couple of podcasts about memory and supporting the hippocampus and then some. But you want to think about that. So again, problems falling asleep, you're thinking about cortisol and their rhythm. Cortisol needs to be low, right? serotonin needs to be higher to make a precursor to make melatonin, and melatonin needs to be high to dull the pineal gland. Then I have that in the hypothalamus, GABA has to be activated in the ventral lateral preoptic area to inhibit orexin, which is a hormone in that sits in the hypothalamus, but in the posterior and lateral part, that inhibits the hypothalamus, okay, and when orexin is an arousal hormone, to further calm the system down. Also, GABA has to inhibit in the lateral, in the posterior hypothalamus, histamine. So I want to make sure that histamine is inhibited. And once all those factors happen, I can now fall asleep. Okay. And again, we talked about that our podcast looks at giving you guys insights on the mechanism. We want to give, and we want to, and again, passion. We want to empower you to understand why, because it's not just, hey, do you call Jeff Rose or you call Andrew Amigo? Do we have an answer? Yeah. We want you, when you're going to see practitioners, that you have a lot of this ability, and practitioners have this knowledge level so they could better help and serve and better help their clients. So it's two folds that we want. Okay. So that's the first thing. The other things that happen, so we could talk about, so we could give Jeff the mic a little bit. So now we talked about, falling asleep.
Sure. And just a quick note to back on you, Andrew, too, is a lot of studies show how much exercise promote levels of serotonin. And just to make sure that it's kind of understood, it's not that exercise itself actually creates serotonin, but at a molecular level, right, the serotonin has to pass through the blood-brain barrier in order to get to the brain. And so when you exercise, what's normally creating a lot of demand through the brain barrier are amino acids. And because they're bigger molecules and stronger, they'll get through the blood-brain barrier, and that will only leave so much room for serotonin. But when you exercise, you're actually creating a demand for those amino acids to go to the muscle fibers. And so that's getting pulled down, which allows more room for serotonin and things like tryptophan to pass the blood-brain barrier. So exercise is also huge to promote levels of serotonin to help us fall asleep as well.
And that's a great point. That's a really good point.
Yeah. So I think for one, because Andrew's about to get into talking about REM sleep, is we hear about these stages of sleep, and people talk about brain waves and this, that, and the other, and I think Andrew and I are really focused on pathologies and what leads to what. But I think there is some kind of a cool takeaway with these brain waves that they talk about is, if you were to kind of, put the electrodes on our head right now and see kind of what brain activity is going on, is you actually don't really see much noise at all. And that's because with our eyes open, we're hearing things, we're thinking things, is the circuitry is going in all sorts of different directions. But the moment I close my eyes and I start to attempt to sleep, it's not that my brain necessarily slows down, but the action in my brain becomes more unified. So stage one has what are called theta waves, and stage one is like our kind of slow transition stage into getting into a deeper sleep. And what you'll actually see is, if you were to compare the activity or the wave, the rhythm of the brain when you're awake versus this transition stage, is it actually starts to create a rhythm, right? And that's why they call them waves. So I for one think that's interesting. And what you'll see in stage one is the first thing to shut off. And Andrew, this is the occipital lobe is really the first thing to kind of power down and begin to get a rhythm, because occipital lobe is visual processing, right? So you're not taking anything in anymore. So and by the way, each stage is estimated to last about anywhere from 15 to 25 minutes. Stage 2 is where you really start to actually get some sleep. It's a deeper level of sleep, but not REM sleep. The rhythm begins to increase, so it's rapid, more rapid than stage 1, and your body temperature starts to go down, your heart rate starts to go down. But there's also something really important that happens, which is we start to get sleep spindles, which is a lot of action with neurons. And this is where it's also important, Andrew talked about like the hippocampus before, is this is where, the old adage we think is that the brain powers down, which is not true at all. The brain is extremely active. And what's actually happening in this stage with those sleep spindles is they're acting as administrators to help organize our brain. So if I learned something, or I read a book, so on and so forth, it basically helps like an administrator kind of organize our thoughts and help store our memory. And that's where these sleep spindles are really important. And those sleep spindles are at their highest level in stage 2. Stage 3 is as we move on to even deeper sleep are what we call delta waves. And those are actually extremely slow waves. And it is the deepest sleep that we get outside of REM sleep. And then when you move into stage 4, REM sleep, that's where the brain actually becomes even more active than those first 3 stages. But the actual body itself, like our muscles, become the most relaxed and in a lot of cases actually immobilized. So while we go through stages 1, 2, 3, 4, and then it repeats, as we actually go through the night, those stages actually don't have to all repeat. A lot of times as we get later into the night, we go more so stage 1, 2, 3, 4, and then back to 2, 3, 4. And the reason why this is important and why we talk about, things like memory loss, right, with lack of sleep, brain fog, so on and so forth, is because if we are losing those last few hours of sleep, right, I'm waking up at 4 a.m. because I'm stressed, or 3 a.m., so on and so forth, you're actually losing the more important part of sleep, because the ratio of REM sleep actually begins to increase relative to the other 2 stages. So while you might sit there and say, well, whatever, I only lost 2 hours of sleep, you're actually losing a greater percentage of REM sleep, which is extremely important for organizing information, for replenishing our nervous system, for replenishing our hormones, so on and so forth. So I think that's really important for people to understand is, there's a lot of talk out there of, do we really need 8 hours of sleep, so on and so forth. And there's actually a bigger argument that it should be more about consistent, right? Whether you're falling asleep at 10 p.m., 8 p.m., or 12 p.m., you just want to find a consistent, and that will help those rhythms. I know it's a bit morbid, but I heard there was a study done back in the 90s that they sleep-deprived animals until they died. And they did a study where they took a group of mice and they compared a group of sleep-deprived and a group that they gave no food or water to. Both groups died in the same time. And I think that's really important to understand is that group that was sleep deprived had food and water, but they died in the same amount of time as the other group that was allowed to sleep, but wasn't given any food. And your brain will not be able to regenerate itself, will not be able to organize itself. So I think it's very important to understand. And they obviously don't do those studies anymore because it's rather brutal and inhumane. But I don't think it's talked enough about how important it is to get that full night of sleep. And lastly, Andrew, before I kind of give the mic back to you, according to Dr. Matthew Walker, who he's written books, he runs a sleep lab study. He actually talks a lot about mental health and the lack of REM or deep sleep. And there's a huge correlation between people who are depressed, people who have attempted and succeeded at committing suicide. There's a huge correlation with those things and lack of sleep. And I think, Andrew mentioned it before with the hippocampus and memory and all that stuff. These things are going hand in hand, because people can sit there and say, well, I have anxiety, so I can't go to sleep. But when you don't sleep, you're just ampling
Into
that
the anxiety.
anxiety
Yeah.
even more.
Yeah.
And we have to remember that if this deep sleep is really important for kind of organizing our brain, replenishing hormones, it's basically our first aid for mental health.
Right.
And not to keep going on about this, but we think about, as a parent and you have a 4-year-old, how important do you think that is for your 4-year-old to get his midday nap? It's vital. And you will do anything to make sure your 4-year-old gets it, because otherwise they're irrational.
Right.
And so for us as adults, it's also important too. Like if you're suffering from depression, suffering from anxiety, yes, we can talk about food, we can talk about exercise, and those things are so key, but you got to sleep. And that's what's going to help kind of keep the downward progression or the downward spiral. That's going to keep that at bay and help you actually recover, if that makes sense.
Yeah. And Jeff, that was very, very well said. That was excellent. I mean, tremendous amount of value that you were able to add. Tremendous. A lot of good, research Jeff has done. And I thought that was extremely well said.
Thanks.
Yeah. So also, when you start to fall asleep, your 1 to 3 stages, all your neurotransmitters are inhibited. What happens is in sleep 4 with REM, this is very important. So what does REM stand for? Is rapid eye movement. So what is rapid eye movement? It's basically, I say a saccade, but I think it's really pronounced a saccade. So saccade. So I say saccades, but it's really a rapid eye movement, right? Which is other known as, most people say saccades, but I say saccades, the way I pronounce it. And that saccade is basically a frontal lobe activation. So again, that's another neurological mechanism, is to look at people's how their saccades are. And then with that, and again, when I say to you coordination, balance, watching people walk, their eye movements, their sleep, their blood sugar, inflammation, these are like, these are digestion. These are like 7, 8 things that no matter who you're going to see, you got to make sure those things are people are working properly. So eye movements, and obviously you're going to hear us talk a lot about. And why do we talk about eyes? It's very interesting that the eyes are the gateway to different parts of the brain. I mean, you don't always have to have a visual problem to say, can I use the eye system in my rehab? And I get that a lot. I'm starting to do a lot of demos now with our software. And I mean, I've met some wonderful people, all walks of life, from physical therapists, chiropractors, trainers, neurologists, neurosurgeons. And they see a lot of what we do is in our 6 programs, which we'll be enhancing this year. We're going to add mirror therapy. We're going to virtual reality, mirror therapy, augmented reality, reaction time training. But why the eyes? So, and Jeff and I, interesting, I was talking about, we're getting our phase 1 out there, but at the same time, we're giving demos, and the next couple of months we'll probably be signing clients up. But what's happening is, I talked to Jeff today about, one of our programs is a virtual reality eye program where we can measure the eye movements. And one of our programs is a virtual reality eye program, and we're going to work on development of being able to track the different eye movements in that program. There's a software called Toby that we're going to layer on top of our program called Optimizer VR, which is our eye program, virtual reality. Why is that important? Because the eyes, it's just not visual. It's not just eye movement issues. That's one. Also, when people have visual problems, 2. And 3, we use the eye system to activate different parts of the brain. Because I mean, when you look at the eyes, you look at what the eyes connect to and the different parts that it projects to. it's a no-brainer to understand the eyes inside and out and to use it. And that's why it's a big part of our system. But go back to the REM, rapid eye movement is a saccade. We look at those saccades, and that's something that we can help the client to improve their saccadic eye movement, which we have many ways that we could do that. So we look at that. It's so that the other thing is from a neurotransmitter standpoint, acetylcholine. That's why Jeff was saying that the acetylcholine, because REM is a very interesting part of sleep. It's a sleep that you're in a dream. So REM, rapid eye movement, so it's the frontal lobe. You're in a dream state. Sometimes you remember the dream, sometimes you don't, but you're in a dream state. So you're very, very deep. But at the same time, those, and I think Jeff said it, the delta waves, right? The delta waves. So the brain is high brain activity, right? So because from REM, you're very, very close to because acetylcholine is one of those neurotransmitters that for memory, but also helps to arouse us. So orexin
For sure.
and acetylcholine is what. So what's acetylcholine also? This is where I get so juiced up I can't even sit still. Is I love the connections, because the more you understand how things integrate, is acetylcholine is one of your transmitters from memory. The acetylcholine supports the whole, and I mean the whole autonomic nervous system,
Right.
because you have a pre-system and you have a post-system. The parasympathetic system uses the pre and post acetylcholine. The sympathetic system uses pre, and then it uses a post norepinephrine and epinephrine, right?
Yeah.
So as a neurotransmitter. So the key is that acetylcholine is very important. So how do you boost the acetylcholine? Well, things like organic, if you're not have an allergy to eggs, because some people do, but eggs, there's other things like liver. So liver is like or grass-fed organic liver is like a superfood,
Right.
and it has choline in it. And then supplement-wise, phosphatidylcholine, okay, is a precursor to make acetylcholine. So boosting your phosphatidylcholine levels can help a lot too. So, and again, like Jeff's pointed out, a key thing is those sleep cycles you're going through multiple times a day. So it's kind of like, if you can master, I think sleep is what Jeff talked about. The emphasis is the consistent time going to sleep. And then I think the consistency of the mechanisms, all those mechanisms of how to fall asleep, how to stay asleep, staying asleep, things that can inhibit that is low oxygen levels. And one of them, and I'm going to lead into that, is sleep apnea, which I do have. Now, sleep apnea, there's a couple types. There's obstruction, which is more of the common type, which a lot of that has to do the circumference of your neck. So obviously, I've lost probably over the last year plus 6 months, 7 months, about 30 pounds. I need to lose more too, but I might have a neuro component too, which is how your pontomedullary and your brainstem is functioning. So there's a neuro component, and then there's also the obstruction. So obstruction a lot of times has to deal with the circumference of your, especially when you go into extension and you have and the circumference of your neck is big, that could decrease the airwaves. And then again, when oxygen levels go low, an inverse relationship happens. It arouses us and gets us up. Okay. So, and if you're having any problems and you think you might have, or if you snore, definitely get checked out. I've been on a CPAP machine now for probably the last, I would say, 2 years now. I've been, and it's significant difference in my sleep, overall health. Because remember, when those low oxygen levels, that can increase heart rate, increase blood pressure. Again, so this whole cycle, because everything is connected. Everything is connected. So again, like to review, falling asleep is very important. And then staying asleep, the other things I recognize too is blood sugar too. Sometimes a trick that I've used is a little protein and fat to stabilize your blood sugar. So again, if blood sugar levels sometimes drop a little too much, that could cause an increase in blood sugar, and that could increase in norepinephrine and epinephrine, and that could cause an arousal effect as well. So stabilizing blood sugar, so like getting protein, getting like a little snack, and saying getting a piece of celery and like almond butter, that has a little protein, or a protein shake with a little almond butter in it, that could help allowing you to stay asleep. So again, managing blood sugar, that's one. Cortisol levels, two. Acetylcholine, making sure that neurotransmitter, making sure GABA. So a lot of your neurotransmitters, a lot of your hormones, like I said before, some of the tricks with GABA, we have them do some of the brain vestibular work before we go to bed. Obviously too, to further calm the system, meditation, meditation and breathing exercises, meditation, activate that parasympathetic system to try to drive more GABA. That GABA inhibits the orexin and histamine, making sure you're not eating foods that have your allergic reaction. Then you can fall asleep, right? And then making sure you got blood sugar that you could stay asleep. Then making sure that your eye movements and saccades are doing really well, your frontal lobe activation, making sure that the cortisol is the amount of cortisol and the rhythm is important, to make sure also your memory centers and your hippocampus and your acetylcholine is really good, so you can get into that REM sleep. And then waking up, arousal is your orexin and your dopamine, right? So making sure the dopaminergic activating system, so making sure that your dopamine levels are good, making sure that your acetylcholine, because acetylcholine not only is for the REM, but is also for the arousal as well. Because REM is very, very close. And I'm sure people have had this experience, that all of a sudden you got into some deep, deep sleep, and you felt like so good, like you got into deep sleep, and you're like, your dream feels so real. And then all of a sudden, like, boom, you just like wake up, because that acetylcholine is there for memory, is there for the REM sleep, and is there for that first level to help you arouse yourself and get up. That's why there's a lot of brain activity during the REM sleep. So,
For sure. Yeah, that's great. And I just to add on to that, Andrew, with acetylcholine, so some people like to talk about acetylcholine almost like a lubricator for the brain. When you talk about brain fog, it just helps us get through our thoughts a lot faster. So again, the production of that is also very important.
yeah. So I thought this was, Jeff, and I wanted to say this was a really, really good webinar. I think a good podcast. I think something to remind us, and I'll say this on the podcast, is I'll try to bring up a document on tryptophan a little bit, because we talked about that. So again, we talked about cortisol, we talked about the hippocampus, the memory centers, acetylcholine, we talked about GABA, we talked about the autonomic nervous system, the anterior, we talked about that has effect on the anterior part of the hypothalamus, has an effect on the parasympathetic, which calms us down. The posterior and lateral hypothalamus has an effect on the sympathetic nervous system, which drives us, arouses us, gets us going. We talked about when we get into we talked about blood sugar helps us, the management of blood sugar to stay asleep. We talked about also making sure you don't have sleep apnea, that helps you with the CPAP, with oxygen levels to stay asleep. We talked about sleep apnea, that you can have obstruction, which is the most common, which is the circumference of, most of the time, the increase of weight in the circumference of your neck. We talked about the neuro component. There is a neural part of sleep apnea that is the pontomedullary system of the brainstem. So we talked about a lot of different things. We talked about getting in the REM sleep has to deal with your eye movements and looking at your eye movements, your frontal lobe activation, and acetylcholine. So we really kind of put it all together. Jeff did an incredible job about talking about the brain waves, and the different and the different parts of sleep, sleep 1, 2, 3, and 4. So I thought, Jeff did an amazing job. And, we all just want to provide value. If you're a client and has a question, you can always contact Jeff Rose at Rep. If you have a question, you could contact me, Andrew Amigo, at The Accomplished Brain. If you're a practitioner and you want to know more about the work that we're doing, we do offer a course. We have a software now that we're leasing to you guys and the practitioners. If you're a client, you could love to work with Jeff and I, or, we're getting more practitioners involved in the work that we're doing, trying to get our message out there. All we want to do is provide value, great content, great information, and we want to help as many people as we can to improve their health.
Well, thanks so much, Andrew. Today was awesome. Thank you, everyone, for joining us today on the Accomplished Brain podcast, and we'll see you next time.
We'll see you next time. Thank you, Jeff.